Your health on DayBreak USA.
22 minutes after the hour, kidneys. Let's talk about kidneys. Dr. Russell Silverstein is our guest, and Dr. Silverstein is a fellow of the American College of Physicians and a fellow of the American Society of Nephrology. And D Magazine in Dallas for multiple years has called him a top doc or the super doc for quite some time. Dr. Silverstein, nice to have you with us on DayBreak USA, sir.
Good morning, Ron.
Appreciate you taking the time to come along. Hope you have your coffee cup with you and can answer some questions for us.
I'll certainly try, and the coffee is ready to roll.
Good. Let's start with the kidneys. What is the main function of kidneys?
That's a very good question, Ron. The kidney basically rids the body of toxins that we do not need, like urea and other waste products, and it is separated from the blood. And in addition, the kidneys conserve water, salts, and electrolytes that our body needs. Simply put, it filters the bloodstream in order to get rid of all the toxins.
Well, a little sidebar question then. There are some dishes that are made from animal kidneys. Why would we eat animal kidneys if they are filters like that? Don't they retain some of that toxicity?
Animal kidneys, the proteins are what's very, very important. And the good protein is kept, and the protein is broken down to waste products, and it's the waste products that our bodies do not need is what's filtered, and urine is what our kidneys have filtered out.
Now, there's, I guess, probably a lot of misunderstanding about kidney disease. I guess probably, if you would, tell us how many people are affected by kidney disease in America and how serious it can get.
27 million to 30 million people are affected, and certainly if you have problems with diabetes and high blood pressure, those are the most two common problems that we see that can develop kidney disease.
Is kidney disease a single disease, or is it like cancer? Are there multiple diseases all under that heading?
There are multiple diseases. So you can have kidney disease from diabetes, high blood pressure, diseases of various components of the kidneys called glomerular disease, over-the-counter medications. Certain ones can cause kidney disease if you take these drugs continuously, and even kidney stones can cause kidney disease.
It's a little dangerous to talk about symptoms because people hear symptoms, they say, I've got it. But give us an idea of what some advanced symptoms of kidney disease might be.
If you have severe chronic kidney disease, you can have fatigue, malaise, nausea, weakness, shortness of breath, and swelling of the legs especially.
I understand that there are ways to evaluate kidney disease at different stages, like lab values or numbers that are assigned to it. Can you explain that? I'm not even familiar with that.
Sure, Ron. Abnormal lab results are usually the first sign that kidney disease is present, even without the symptoms that we have discussed. And some of these tests include elevation of the creatinine and BUN, or blood urea nitrogen. In the urine, you can develop protein, red cells, and white cells that are abnormal. And finally, a test called glomerular filtration rate can help calculate your kidney number. And this kidney number can help determine the severity of kidney disease. There are 5 mainly areas of kidney disease, stage 1 through stage 5, before one would need dialysis.
All right, let's go with that for a moment then. At what point in those lab numbers and in that 5-step thing you're mentioning, does a person say, or does the physician say, you have come to me almost too late, don't let it get this far? Where do you want to get serious life-saving treatment going?
Usually at kidney disease number 3 is where we would like to see patients before things advance and progress. And mainly, the reason for that is we can help prescribe medications along with your primary care doctors or other specialists that can help preserve kidney function and reduce the progression of kidney disease. So hopefully, dialysis or a kidney transplant would be avoided.
All right. Now, I'm 75 years old, an extremely cool 75 years old. But at what age, I'm very, very healthy, but what age should I or anybody my age or even younger be paying attention to kidney numbers?
All ages are important. So pediatric patients, along with young adults and older Americans like yourself, can develop kidney disease.
Any specific demographic? Is it more in Caucasians or African Americans or Orientals? Do you see more of it?
Kidney disease occur more in African Americans and Hispanics.
Why would that be?
We're not sure.
Diet? Would you think diet might have a lot to do with it?
Diet doesn't, except if you have kidney disease. We do recommend a balanced diet, low in fat, salt, and sugar. And if you have diabetes or hypertension, this kind of a diet would be very, very important. And certainly, just like you had mentioned, Ron, your healthy lifestyle changes, including exercise, is very important along with diet.
Name me one really good, important food that I need a lot of to stay healthy.
Water, liquids, to stay well balanced, you need to stay well hydrated.
I like the things you say. Dr. Russell Silverstein from Dallas, lived in Dallas for a while, love it. Thank you so much for your help today. We really appreciate it.
You're very welcome, Ron.
29 minutes after the hour, more coming ahead.